the invitation to give a talk in this meeting. To start off with, it's a pleasure to talk here among bright scientists. I will talk about two function pump in signal transduction of sodium-potassium ATPase in inflammation and cancer. Leptospirosis is an infection disease caused by Eubacteria the Leptospira. Both wild and domestic animals can spread the disease, most commonly rodents. When humans got infected, may develop severe leptospirosis, called Weil syndrome. The hypokalemia draw attention to a possible role of sodium-potassium ATPase in the process. It's not passing. Okay. The main affected organs in severe form of leptospirosis are lungs with acute respiratory distress syndrome with lung hemorrhage, liver with atypical hepatitis, kidneys with acute renal failure with hypokalemia. This is the enzyme structure. As we can see here, sodium, potassium, ATP, and ouabain binds to alpha subunit. The main enzyme function is maintain the ion gradient expanding ATP in the process. Leptospira colonize primary kidney and liver. The leptospiralizes by the immune system response ends up releasing endotoxin, such as GLP, glicolipoprotein, called leptospirase endotoxin, able to inhibit sodium-potassium ATPase. Unesterified fatty acids, such as oleic, palmitoleic, palmitobassanic acids, are the components thought to play a major role in this inhibition. So, GLP targets sodium-potassium ATPase in proximal tubule in kidney, avoiding sodium uptake, which increases sodium into the lumen, increasing sodium uptake at distal tubules, partially explaining the hypokalemia. So in leptospirosis, in patients with leptospirosis. The next step was to measure sodium-potassium ATPase inhibition by oleic acid and GLP. As can you see here, oleic acid inhibition is more pronounced in purified enzyme, while GLP has a more selective inhibition because its inhibition is the same in purified and crude enzyme. It's interesting, by adding albumin, the inhibition is completely reversed. In fact, fatty acids can be toxic or have beneficial effects. Here I show different effects of fatty acids. Fatty acids can alter lipid rafts, can bind to TLR, can inhibit the NKA, which may trigger intracellular signaling as signalosome or NLRP3 inflammasome, or leading to calcium oxalations. In the context of infection disease, sepsis can be defined as life-threatening organ dysfunction caused by dysregulated host response to an infection. In the back, it would be believed that inflammatory response caused metabolic alterations. Currently, inflammatory response, metabolic alteration, and mitochondrial dysfunctions are believed to happen at the same time. Critical ill patients with severe leptospirosis or sepsis present high levels of non-esterified fatty acids, mainly linoleic and oleic acids, with lower levels of albumin that binds fatty acids, avoiding its toxic effects. As you can see here, patients with septic patients present the same pattern as severe leptospirosis patients. To measure unsaturated fatty acid requires expensive equipment and specialized workers. So we developed a way to indirectly measure fatty acids levels in critical ill patients through albumin saturation test. By using isoelectric focusing, we can infer the amount of fatty acid present in the albumin, since fatty acids have a negative charge in physiological pH, and albumin can bind up to 7 molecules of them. We have measured, taking a while to pass. We have measured levels of NIFA, non-esterified fatty acid, in septic patients, critical ill patients, and they present higher levels of NIFA and lower levels of albumin. So, higher the ratio of NIFA albumin, more saturated albumin are, and more likely to have high levels of NIFA unbound to albumin and thus damaging cells. This test will indicate to physicians when albumin should be given to the patients. We also evaluate the relationship between oleic acid and albumin with clinical outcome in patients with leptospirosis. If the ratio oleic acid albumin drops, the patient is more likely to be discharged. Contrary to what happens if the ratio oleic acid albumin remain high, in case of the patient are more likely to evolve to death. This review discussed the role of GLP and fatty acid in inflammation during leptospirosis infection. The leptospiral will colonize several organs, and the immune response will kill bacteria, releasing endotoxin such as GLP and LPS. GLP and LPS could bind to TLR or NKA, triggering intracellular pathways such as NLRP3, described by Catherine Verts, inflammasome, fostering inflammatory mediators production, which will create a micro-inflammatory which will increase the inflammatory mediators and NEFA, leading to organ dysfunction and, in some cases, even death. Oleic acid is one of the main NIFA increased in critical ill patients. Oleic acid inhibits sodium-potassium ATPase and impairs edema clearance. The leading cause of death in critical ill patients are the ARDS with lung failure. So, oleic acid inhibits both sodium-potassium ATPase and epithelial sodium channel. Both are present in cell type 1 and 2, and so they are critical to optimum edema clearance. We ask, does oleic acid induce lung injury similar to IRDS? In fact, it is able to inhibit fluid clearance, but would it also induce inflammation with inflammatory mediator production, cell recruitment, and cell death? To answer that, we inoculated oleic acid in two routes in the mouse, intravenously and intratracheally. Oleic acid was injected in salt form, which is physiologically, which represent the physiologic form. And 24 hours later, we kill the animals and analyze the lungs. The oleic acid inoculated intratracheally did induce lung injury similar to ARDS, with hemorrhage, inflammatory cell infiltration, tissue damage, with loss of function. The oleic acid also induced ERK phosphorylation, and the inhibition of ERK prevented neutrophil accumulation and IL-6 production. The oleic acid inhibits sodium-potassium ATPase in vivo and induces lung injury. Actually, both ouabain and oleic acid induces lung injury with inflammatory cell infiltration, hemorrhage, and tissue disruption. But more importantly, both block rubidium incorporation in lung tissue in similar way. Next, we developed an assay to test sodium-potassium activity in situ in the lung mice. We perfused the lungs for 15 minutes with warm modified Hank solutions with rubidium. Next 5 minutes, lungs were perfused with cold saline to stop the enzyme. The lungs were removed and digested at high temperature. And finally, rubidium was quantified by ICP-OS. As you can see in the graphs, the amount of incorporated rubidium were higher than previous experiments, and oleic acids inhibits only partially the sodium-potassium ATPase. Additionally, we discussed the oleic acid role in IRDS induction. With the IRDS, there have two alterations: metabolic alteration, mainly especially with fatty acid, and inflammation. Oleic acid in this model, in this idea in IRDS, inhibits sodium-potassium ATPase sodium channel, causing lung edema, increases permeability, cause cell death, foster leukocyte recruitment and activation with increased production of inflammatory mediators. So, oleic acid is the component of GLP that inhibit sodium-potassium ATPase. Can leptospiral GLP induces lung injury? Yes. GLP induces lung injury with intense bleeding into the alveoli with lung structure disruption, inflammatory cell infiltration, and lung edema. Lung inflammation was independent of TLR4 activation because GLP induced cell accumulation and edema in both wild and knockout mice. Curiously, GLP induced P38 phosphorylation, different from those in oleic acid. Here I will show NKA signaling, transduction, and crosstalk. We want to go over every pathway, but the key is to see that NKA signaling could act synergically to TLR to create a greater response. As you can see here, oleic acid, ouabain, and GLP may target the pump, triggering intracellular pathways, which may synergize with TLR, since during infection you have increase of saturated fatty acid and LPS, which activates TLR. So molecules targeting sodium-potassium ATPase may have both effect, inhibits ion transport and trigger intracellular signaling. And the second part of presentation, and sodium-potassium ATPase inhibitors, cardiac glycosides non-related structure could have anti-cancer activity. In collaboration with KISS Group, we developed and tested thiazoles derivatives compounds, such as 12B. Here, just to show that compound 12B, just to show that compound 12B had a potent inhibition on sodium-potassium ATPase activity. And so we tested if 12B would differ in purified sodium-potassium ATPase and crude sodium-potassium ATPase and magnesium ATPase. And 12B compounds showed high selectivity to the enzyme inhibition. Here is just to show that the compound 12B differs from ouabain inhibition profile, having a non-competitive inhibition with sodium and potassium, and uncompetitive inhibition with ATP. The other compound, the monoterpene peryl alcohol, POH, found in peryl essential oils, lemon, ginger, and mint, has antitumor activity, causing cell cycle arrest and induces apoptosis. POH inhibits purified enzyme from guinea pig, from brain and kidney. And also, it inhibits human glioblastoma cells ATPase. Finally, POH, perylyl alcohol, also inhibits the enzyme in glioblastoma cell lines U251 and U87, as shown here, with IC50 of 1.8 and 2.0. Also, POH also has a cytotoxic effect in doses-dependent fashion in glioma cell lineage. The cytotoxic effect is related to JNK1 and 2 MAP kinases because POH induces GNK in a dose-dependent fashion as well. Higher the dose, higher the phosphorylation activation. The GKNA activation was avoided by cell pre-treatment with dasatinib, which is a SAR kinase inhibitor, and cyclodextrin, which depletes cell membrane cholesterol. As you can see here, dasatinib and cyclodextrin completely blocking the JNK phosphorylation. Another compound with structure is also POH also induced apoptosis in those cells since they're in a fashion dependent of JNK, because the use of JNK inhibitor partially blocks the activation of JNK by POH. Another compound with a structure non-related to cardiac glycosides, the polygodial, which is an agonist of TRPV1. This compound, our group showed effects of polygodial in these derivatives and showed that these compounds retain activity against apoptosis in multi-drug resistant cancer cells. Compounds 1, 4, and 5 inhibit sodium-potassium ATPase with higher potency in purified preparation in kidney and in brain, purified preparation and crude preparation. Interesting, the compound 1 and 4 present a non-competitive inhibition, while the compound 5 is a competitive inhibitor. So, sodium-potassium ATPase inhibitor with cardiac glycoside non-related structure could be used for cancer therapy. I came from a huge lab and very huge. And recently I have established my own lab, which is increasing. Finally, I would like to thank all co-workers who directly or indirectly contribute to the work and funding agency. And the last but not the least, I would like to honor my advisor who has passed away this year, Professor Mauro Castro Faria. Thank you.